Good.
Americans need health reform. I completely agree with that statement. In fact, nearly 3 years after President Obama's health care reform law passed, and after the U.S. Supreme Court's upholding of the law, I believe we still need health care reform. Why? I'll answer that question, but let me give you some information first. Dr. John Goodman, an acknowledged leading authority on health care policy, offered 5 basic principles in his 2009 congressional testimony. Healthcare should be portable. No one should be trapped in a job because they can't get quality health insurance under a group plan and a new job. Affordable. Health insurance premiums have steadily gone up. Able to treat chronically ill patients. Whether it's a lifelong disease or a condition, or a sudden onset of illness, your health care plan should be comprehensive to the care for you. Controlled by patients and doctors. No one should be able to get between your doctor and you. Able to protect seniors. There is no reason this nation's older population should have to choose between buying groceries or buying their prescription medication. Sounds simple enough, right? But the net effect of Obamacare is going to accomplish none of these priorities. Portability is not achieved under this plan. People who leave a job or otherwise drop their coverage will be forced into the government-run health insurance exchanges. Only a greater dependence on the government will be achieved. Affordability is not achieved. Private health premiums are already going up because of Obamacare mandates. The costs to meet these mandates are going to be passed on the people who already exercise the personal responsibility to have health insurance. Chronically ill patients are no better off under Obamacare, which really only expands the number of people under Medicaid and Medicare. It does not make coverage more comprehensive in the treatments covered in these plans. Not only does Obamacare create a barrier between your doctor and you, but your doctor may choose to quit the practice of his medicine because of Obamacare. In a nutshell, we will now have a low-paid government bureaucrats who have never seen you making decisions about your treatments. Not only is protecting seniors a priority, but their care is actually rationed under Obamacare. You can't claim to ease the cost of insurance when all you're really doing is lowering the coverage. Here's what Obamacare does accomplish. It provides more Americans with access to health care, whether they want it or not. It's like going to McDonald's. We're all going to eat, but we're going to get the same crappy food, and only some of us are going to pay the bill for all of us. And if you want steak, you're just out of luck because that's not how socialism works. Let's all call Obamacare what it truly is: socialized medicine. These types of systems exist in England, Canada, communist Cuba, and other countries. But let's consider what the U.S. health system produces. We produce more medical research, more medical innovations, and more advanced equipment, more effective drug therapies, more physicians, and more medical professionals, and the more bottom line results than any other country on the planet. I agree that we need reforms to our system, major sweeping reforms. But I reject the notion that we make a faulty system better, or more efficient, or more cost-effective by turning it over to government. Oh, and once you add a bunch of lawyers to the mix to argue about health care you should or should not receive, and all that is accomplished is to cripple and deform a faulty but functioning existing system.
Thanks, Madison. That was fun. It's very informative.